to help with this surge in cases and the destructive effect it is having on our city's small businesses. Secondly, I want to say that I take absolutely no joy in making these changes. In fact, it's heartbreaking for me as someone who loves this city and desperately wants to see a speedy recovery from the effects of this pandemic. But my heart also breaks every day when I receive a report on the deaths of our neighbors who fall victim to this virus. My heart breaks when I hear from the first responders who are risking their lives under increasingly dangerous conditions. My heart breaks when I hear from doctors and nurses who are watching hospitals across the country filled to capacity with COVID patients and worry that our city could be next. And this statewide surge shows no sign of stopping. Just yesterday, Marion County reported more than 700 new cases. I want to acknowledge that the causes for increasing cases in Marion County are likely myriad. But there are some clear indicators of where community spread is taking place. Some of those locations are not surprising. Events or gatherings that are held inside, co-workers who have returned to the workplace, or frankly, events such as weddings or funerals. But I want to be clear that we're also seeing a fundamental shift from community spread in public places to infections that are occurring within private homes, between extended family and friends. I want to again plead with every resident in our city: be safe, wear a mask, avoid crowds, and avoid unnecessary trips. That way, fewer of us will contract this virus and bring it home. But just as importantly, please recognize that this virus doesn't care if you are in public or not. And social gatherings that you have at your house are just as dangerous. I say that because it is not lost on Dr. Kane or myself that the holiday season is upon us. And I know thousands of you, tens of thousands of you, here in Indianapolis are wrestling with how to handle family gatherings. Dr. Kane will likely have more to say on this subject, but for my part, I want to be blunt. There is no responsible way to pretend that this Thanksgiving and the ensuing holiday season that follows will in any way be normal. To echo advice that we learned from Dr. Box yesterday, I want to urge residents to scale back their Thanksgiving gatherings. Consider connecting with elder family members or extended family through video chat or through phone calls. If weather allows, eat outside. Don't travel if you don't have to leave the home. And if you do travel to family gatherings, please quarantine yourself upon your return that will help stop the spread of the virus. None of that will be easy. And it certainly will cut down on the holiday fun. But deciding to do these things could truly be a life or death decision for those you love. That's somber. And I know it is. With that, I'd like to turn it over to Dr. Virginia Kane, Director of the Marion County Public Health Department, for a data update and the latest what it means for our K through 12 school systems. Dr. Kane.
Thank you, Mayor Hogsett. As we know, we're having surging cases across the United States. And actually here in Marion County, as Mayor Hogsett stated, we reached over 700 some cases yesterday. And at the rate of rise that we are going, we may hit later as we see our data, we may even reach 1,000 cases occurring a day. Almost getting back to when we're at the height and peak of our COVID-19 cases. And so we're reaching that critical point, and this is our critical point, that we really have to practice our preventative measures in order for us to avoid going back to the stay in shelter that was so critical for all of us. So please, let me show you what is happening across the country, the Midwest, and Marion County in the state of Indiana. Next slide, please. And I'll have this. So, look at this map. This is a map of the United States, and it's looking at just infection that occurred just last week, okay? So this is a map that was done yesterday. And if you look at the Midwest, these are the cases that are the greatest cases, over easily 56 cases per 100,000 population. Those cases that are in the darkest red shows the density of the COVID-19 cases in our country. And the hardest hit area is in the Midwest. So if you can look and see the state of Indiana, look how dark it is, followed by Illinois, Wisconsin, Michigan, the Minnesota area. So that whole population density of COVID-19 cases is significant here. And for the first time, Indiana, the state, reached over 5,000 cases in a day this week. And we believe that if we're not going to hit 1,000 new cases a day today, it will happen probably by tomorrow. So we're going to have to be very aggressive about how we approach control of this infection. Next slide. When we looked at our percent positive, back in the last 2 weeks of August, I want to remind you that we were at a 5% positivity or lower the last 2 weeks of August. And as you can see from the beginning, mid part of October the 12th, we were still at 5%, but we started to see a steadily climb of our positivity rate until we were at 10.3% on November the 4th. And that's as far as we do our 7-day analysis. And that was a really critical point of concern, as mentioned earlier by Joe Hogsett. as a community, we need to be at 5% or below for our positivity rate. That tells us we've made substantial gains, achievement in reducing community spread if we can keep our positivity rate at 5% or low. But we have since doubled our positivity rate. So at a very critical time in order to get control of this infection. Next slide. Of our other most important criteria that we identify in order to address our COVID-19 infection rate in our communities, we look at the new confirmed cases that occur, but we look at it on a 7-day average. So while I talked about we had over 700 cases yesterday in a day, if we average the last 7 days, we have now gone from less than 184 cases back in the early part of October, where we were in 180 some cases. We have now driven our 7-day average of new cases a day up to 367 cases through November the 6th. So we are steadily, slowly climbing, but we are seeing now as the cases increase, our rate of increase will go up faster. So we have been averaging 1% positivity going up one point by every 4 days. As our cases increase, it will go up more rapidly. Next slide. When we looked at the tests that were positive, we were at the 10.3%. Next slide. I'm sorry. When you saw we were at the 10.3% positivity rate, what happens as a result of that? We start seeing more cases. The weather's getting colder. We're starting to get into the flu season, but we're also seeing more emergency room visits with the COVID-19 symptoms. So around about the first week in October, we were experiencing about 20 emergency room visits of COVID-19 per day. We are now up to 54. We more than double our emergency room visits with COVID-19 symptoms. Hospitals across the nation are being packed, surged at their critical points. Just in the last 2 weeks, we have seen our hospitals starting to fill with COVID-19 patients. Next slide. So as you can see, we were averaging around about October 7th, about 10 hospital admissions for COVID-19. We are now up to 16 new hospital admissions for persons with COVID-19. So that is starting to steadily increase now. Next slide. In our death rates, we are holding steady, kind of flat, where we had dropped substantially the third week in October. We're coming right back up in terms of our death rates, but basically flat. Next slide. So this is a slide of our surrounding counties based on positivity rates. So you can see if we looked at Boone County, just 2 weeks ago, their positivity rate was at 4.1. They are now overall for their community at 8.8% as a positivity rate. Hendricks has gone from less than a 5% positivity rate to a 9.5% positivity rate. Hamilton County has similar positivity rates as Marion County. They are now up to a 10.2% positivity rate in their community. Johnson County, their overall community positivity rate is 11.2%. And Shelby County is significantly higher at a 13.7 positivity rate. So you can see all of our surrounding counties are increasing in their community cases similar to Marion County. Next slide. When we look at what's happening from an age distribution, in the month of October, we saw our percentage of cases occurring in our 0 to 19-year-olds drop from 20% to 14%. But holding steady are our cases in our 20 to 39-year-olds at around about 41%. And our next largest group is our 40 to 59 years of age, which is holding fairly stable but slightly increasing at a 20% number of our new cases that are occurring in the month of October. And when we look at our seniors, 60 and older, we're starting to see the increase of cases occur in our seniors, which is a major concern because we have a much higher morbidity and mortality associated with our seniors if we go back and look historically. But next slide. This is what has really caught Mayor Hogsett and our team's attention. We're looking at the new cases if we break it down by age group. And we're looking at, when we look at adults over the age of 18, okay, we're seeing now over 55 some cases occurring on a 7-day average per 100,000 persons. This is really significant. That is a very high rate of new cases occurring in that age group. But if we looked at our high school age group, they are reaching over 40 new cases per 100,000 population in a 1-week period. When we look at our middle school, we're seeing that over 28 cases are occurring per 100,000 population. But if just glance back from this map, just go to September the 15th. If you go to September the 15th, look at all of our cases were less than 20 cases occurring on a daily basis. And look how all of these age groups from elementary, middle school, and high school, they've nearly tripled for the month of early November. They've tripled. And so huge concerns for us. Next slide. But this slide will give you just a little bit better understanding because you understand about positivity rate, okay? And we think it's safe if you're able to have a positivity rate less than 5% for over a 2 to 3 week period, along with newly formed cases a day. And we see now that when we look at all ages, we have a positivity rate of 12%. But look at that very top line, that very gray line at the very top. For the first time, we're seeing an 18% positivity rate in our high school students. 18% for our high school students. Even more concerning, when we look at our middle school, they're reaching a little bit over 14% positivity rates. And remember, our prior chart has said that if we reach 13%. That was our criteria set for all schools to go virtual. 13%. So our high schools are at 18%. Our middle school is at a little over 14%. And then when we look at our elementary schools, we're lower, okay, about nearly 8%, but at the rate of rise that we're going for even the elementary schools, we think we're going to reach possibly 12% or higher, possibly by the end of next week, okay? So these are really critical concerns about what's happening with our positivity rate in our schools. And let me say, we did a fantastic job from mid-August up to this point. But these last 2 weeks, we've seen a substantial increase. And we can have a good control in our schools, not a problem. But you can only do it when your community level spread is not so significant. So we could keep that good control of our schools, but when your community spread is rising so rapidly and getting at a higher numbers, then it's not the same safe environment in our schools that we had prior to this. Next slide. So as a result of that, we're now recommending a new change in our public health order effective Monday, November 16th at noon, that bars will return to 25% indoor capacity with 100% outdoor capacity. Restaurants will remain at 50% indoors with 100% outdoor capacity. But let me just say, for those who have outdoor tents, they must be only two-sided, okay? We cannot have an enclosed space outdoors because of the ventilation and circulation. That's how we're able to allow a higher 100% outdoor capacity for the restaurants. Live entertainment and music venues must be cleared of all patrons from 12 a.m. to 5 a.m. What are we saying? Live entertainment and any music venues must be cleared of all patrons. That means you're not taking someone in at 11:55 because they made it in before 12 a.m. and they can sit there and do their thing. They have to be out by midnight. Next slide. Next slide. Our gymnasiums and fitness centers are going to drop from 50% to a 25% capacity. We have new regulations for our long-term facilities that we are now changing, who may be allowed to do indoor visitation. If a visitor can have a negative COVID-19 testing in the last 72 hours before they visit a loved one, if they want to go indoors. So we are requiring them to have a negative COVID-19 test in the last 72 hours if they're visiting a loved one indoors. When we look at dining out, tables must return to seating only 6 people. Tables must return to seating only 6 people, not 10. We're asking all funeral homes now must return to a 50% capacity. And our social gatherings will go from 50, now limited to 25 people. Next slide. So now, for what we think is a major strong emphasis in order to safeguard our children our teachers and our staff, no later than November the 30th, we're requiring that all schools return to virtual instruction. We are happy. If you have the ability to go virtual prior, we'd like to encourage that. And this will include all grades from kindergarten to 12th grade. So I know it may be a hardship for some of you. Some of you schools may have had no cases whatsoever. But it is to the point now, we're seeing significant spread in our schools now, that in order to safeguard everyone, we're asking that all schools be required to return to virtual instruction no later than November 30th. Now, when it comes to extracurricular activities and sporting events, beginning on November the 30th, we're asking that all school extracurricular activities and sporting events can only include participants, their parents, or guardians, and support personnel. So beginning November, K through 12, school extracurricular activities and sporting events can only include participants, their parents or guardians, and support personnel. And this order will end on January the 15th through 2020. So this order ends on January the 15th, 2020, unless we see some remarkable, surprising information. Well, we want to be flexible. Miracles can happen sometimes. But otherwise, these are the instructions and recommendations we have in place right now. I believe that should be the last slide. Mayor Hogsett, I'll turn it back over to you.
Thank you, Dr.
We'll now open it up for questions. As usual, we'll call upon you to put your name and outlet in the Q&A box, and then you'll be able to ask your question with the mayor and Dr. Kane, the others that have joined us here today. Our first question is from Abdul Hakim Shabazz at Indie Politics.
Good morning, Mr. Mayor. Good morning, Dr. Kane. Two questions real quickly here. Dr. Kane, for you, it seems that a lot of these COVID-19 infections are coming from smaller, more informal type events. Have you guys done the contact tracing to kind of sort of back that up to see where the new infection rates are coming from? And for you, Mr. Mayor, kind of a broader question. With the COVID-19 situation, 184 murders, downtown boarded up, protests in the streets, how should citizens feel about Indianapolis right now?
Who wants to go first, Mayor?
I'll be happy to answer Abdul's question, and then you can address the contact tracing, Dr. Kane. Look, Abdul, our city faces many challenges, and I use the word somber. No greater challenge do we face today than the one that we are discussing today, and that is the exponential rise in the spread of the COVID-19 virus. You know, in terms of public safety, we are resolute in keeping our city as safe as is reasonably possible. Admittedly, it's been a difficult year in terms of the number of homicides and non-fatal shootings that we've experienced. But as you and I have discussed time and time again, overall violent crime is going down in the city of Indianapolis. As it relates to boarded up businesses downtown, those are decisions that individual businesses have made, frankly, in light of the election returns last week. Obviously, in light of the release of the the grand jury's decision in the Drejon Reed case. Now, we've had 2 nights of peaceful protests and demonstrations occurring throughout the community, and I'm hopeful that that will continue. IMPD command staff will continue to monitor any large-scale public gatherings, as they always do, and they'll make operational decisions accordingly to ensure the safety of all residents, businesses, and those exercising their First Amendment rights. So I am hopeful that we can get through the weekend with, to the extent that protests occur, that they at all times remain peaceful. And I think accordingly, you know, it's difficult under circumstances that we are discussing today to say that everything is okay in Indianapolis, but I do believe that together as a community we'll get through this crisis collectively, and we'll get back on track here in our city when we have found a vaccine, that it is widely distributed, and that people can return to work downtown. So overall, I'm optimistic about the future of Indianapolis, but I would be less than candid to say we are facing challenges that, frankly, in my estimation, the city has not faced in its 200 years. Dr. Kane?
Okay, so when we've been looking at our hot spots, we're now seeing a trend where we're having smaller outbreaks, or how do I say it, a number of cases that are associated in our households. So we're having smaller gatherings that are triggering and generating new cases for us. And this is something, a new trend that we've been looking at from our contact tracing, probably occurring maybe like in the last 3 weeks. So we're really concerned about this in terms of happening.
Our next question is from Eric Berman at WIBC.
Hello, Mr. Mayor. Hello, Dr. Kane. A quick clarification and then my main question. Do the new orders take effect on Sunday or Monday? I think the two of you said something different on that. And then my primary question, Mr. Mayor, you've said, and the state health officials have said the same thing, and other counties, and even at the federal level, everybody's been saying that we're seeing primarily cases in these smaller settings, in private homes and so forth. So how much do we move the needle with the new restrictions on public gatherings like bars and gyms and so forth?
Yeah, this is Paul Babcock. I'll take that. The new order takes effect Monday at 12 a.m. So as soon as 11:59 at the end of Sunday switches over to 12 on Monday, the order is in effect.
Dr. Kane, do you want to take the second part of the question regarding restrictions?
So I'm sorry, what was the question for the restrictions?
I believe the question was, as we're seeing increases tied to smaller gatherings and gatherings within people's homes, how much do these restrictions on public places help to move the dial?
Oh, I think it's going to help to move the rising cases significantly. When we're trying to get people in their homes, we're asking them to try to lower any social gatherings that they may have in their homes. You know, although community-wise we're saying no more than 25, but we really want to encourage you that if you could do a lower, 10 or lower, I think that would really be fantastic. And I think you have to also be concerned about who you are allowing in your household. So remember, 40% of user residents are asymptomatic. They have no symptoms. They look great. They have no fever. And so if you could cut down on the traffic from outside folks coming to inside your households, I think that's so important, especially if you have a senior in that household and they are over the age of 60 and they have chronic medical illnesses or conditions. So don't forget, we're going to have the holidays coming up, Thanksgiving and Christmas. And I think that if we can practice that more or have some ability to do more outdoor events, I think that would be tremendous.
And Eric, I'd like to add to that. So last week, the CDC released a study indicating that individuals who had visited bars were twice as likely to end up getting COVID-19. And then the Washington Post did a similar study put out recently showing that 20% of individuals who were, using cell phone data had then walked to a bar, for lack of a better description, ended up becoming COVID positive. This is reflective of data out of Colorado and Louisiana as well. And so utilizing this information plus the information we've gathered from our own contact tracing, it's just prudent for us to be able to really decrease the capacity because it does help our contact tracing. As if you have someone over to your house and you end up asymptomatic and someone gets COVID-19, it's a lot easier to trace it back to that point than to a bar filled with a bunch of people that you may or may not know.
Our next question is from Stephanie Wade at WRTV.
Hey, good morning. So my question is, I want to clarify this. So special events, concerts, weddings, and sporting events, they're limited to 25% capacity, but you can get approval for a safety plan, correct, from the health department? Because I think I saw, like for the Colts game coming up like next week or something, they said they have tickets for 12,000 or more fans. So would they have to go through a special approval process for that?
So they go through a special approval process for the number of fans that they have at the stadium. At 12,500, that is significantly less than 25% of their capacity for their game.
And remember, Dr. Haney, they can easily socially distance in that size of a facility.
And that's the point. They can do greater than 6 feet distancing. They're like a 10 or 15 based on the numbers that are attending there at the football game. And we try to look at that. Let me just talk to you a little bit about weddings. We have to look at weddings and people's ability to, how long are they going to be dancing? How long are they going to be eating and drinking? So we try to look at the risks too associated with the event in terms of trying to determine the number of participants at an event.
Our next question is from Richard Essex at Wish.
Thank you, Mayor. Thank you, Dr. Kane, for your time this afternoon. With all of the numbers spiking so rapidly, has any of this been traced back to the long lines for early voting?
You know what? We have not finished our analysis related to that, but I have to honestly say you make a critical point, and that's something that we are trying to dive in or delve into the data, trying to see if we can see an association related to the voting. But what happens now, there's what's called a 14 days incubation period. So you usually don't see the impact from the voting until at least 2 to 3 weeks later. So we still have some time in order to see if we're going to see some of these cases related to the voting.
Our next question is from Russ Dodge at WITT.
Hi, I got a couple of questions. First off, on non-school sports and non-school activities, are they subject to the same attendance requirements, parents but no grandparents, that type of stuff? That's, question number one. And then question number two, seems like there's a few people that don't know about the outdoor grant program. I take it that is still available for people that need the heating and the siding and that kind of stuff.
So I'll take the first question, Russ. So definitely the same criteria. We'll make sure we add that to the order. So those community type sports, they are under the same mandates as we have for the school. So thank you for bringing that to our attention, and we will make sure that that's added to our order.
Thomas, do you want to take the second part of Russ's question?
Sure, I'd be happy to. So just to give a quick 15-second update, we had 2 business assistance programs that were launched kind of roughly at the same time with the remaining CARES Act allocation that we had from March. First was the HELP grant. That project was substantially larger in dollar amount. It had up to $25,000 per hospitality associated business that could apply. The total numbers for that program, as those applications are being processed, are that we received over 600 applications, totaling more than $11.4 million. We're working through those with our partners at the Indy Chamber, but we already had roughly half of that money be approved, and those dollars going out the door for things like rent and mortgage. I would just note, and I made a note of this in our last conversation, that over 50% of those applications were represented by women or minority-owned businesses in the community, which was, I think, the direct result of a lot of work that the Chamber did along with our community partners to ensure that we were able to get that program in front of as many businesses as possible. The second program that I think was directly asked about is the Winter Readiness Grant Program. That application, I believe, is still active. That was a $1 million program. Interested businesses can go to response.visitindy.com/winter in order to learn more about that program. I do want to thank Leonard Hoops and his entire team over at Visit Indy for stepping up to administer that program. We're going to continue to get those dollars out the door. Obviously, we have a deadline under the federal guidelines to disperse those funds by the end of the year, or else they revert back to Congress. But we're well on pace in order to get those funds, as small as they may be compared to the scope of the problem, out the door by sometime in December.
Our next question is from Erica Heron at the Indy Star.
Hi, Dr. Kane. Previously, you had talked about trying to keep schools open because we weren't seeing transmission within school settings. Thinking that schools were still fairly safe. Is that changing? Are you seeing evidence of transmission happening in schools and classrooms at this point?
So actually, we're still not seeing transmissions as much in the schools. They continue to be predominantly out in the community, but we're now having a substantial number of children now within the schools that are positive, more related to their connections out in the community. But when that positivity rate gets so large in a community, I cannot feel confident that we can keep them safe now in that environment because of the increasing numbers of children that are infected in our schools, but also because of our community spread as well.
Our next question is from Eric Weddle at WFYI.
Sorry about that. You can hear me? Hello?
Yep, we can hear you just fine.
Sorry about that. So I just have a question and a clarification. One, the order is for all Marion County schools, correct? The private and public schools?
That is correct.
Okay. And then could you speak a little bit about what you're seeing in childcare facilities? Do you anticipate any type of limits on those, as we saw many do back in the spring?
So right now we are definitely trying to follow that and look at that, but we're in our preliminary analysis related to that, and so I can't give you an answer today, but that is something that we're closely paying a lot of attention to in terms of pre-kindergarten, I guess you want to say, and daycares.
Tom Davies from the AP.
Hello. Do you think the governor and the state are being aggressive enough to tackle the spread on a statewide basis? And do the surrounding counties to Indianapolis need to take similar actions to have consistent rules and slow the spread in the city?
Well, let me just comment on that, and I'll throw it to Dr. Kane as well. Look, these difficult mitigation efforts have been when Marion County is acting alone. The Governor Holcomb's update yesterday, I believe, will help counties to respond to what the data suggests is a clear surge in the COVID cases across many communities. And I want to note that his order still allows county health departments to make adjustments based on individual circumstances, unique needs of all jurisdictions. And obviously, we in Marion County see a real value in doing just that. So I continue to value our partnership with the state as we work diligently to stop the spread of the virus. As it relates to communication that we've had with other central Indiana health departments, I'll defer to Dr. Kane, who has been leading those efforts and where that stands right now.
So we were very fortunate to have an opportunity to have our first meeting with our surrounding local county health departments, and I think it was very beneficial because we learned a lot what was happening in the surrounding counties, but also how it impacts the number of individuals that may reside in those outside counties being visited, even working in our county and vice versa, where they may reside here and living there. So one of the major things that came out of that meeting is that we felt as a region that we need to promote a major campaign related to risk mitigation so that they have a better understanding of the risk for COVID-19 within their household, and trying to really put special emphasis on the social distancing and the mask, but do this education in a manner that really people really understand the impact related to this. And so why when you feel, we have a lot of people feel that because they have no symptoms, they feel great, and no fever, that they're not infected, and they may not understand the risk that they carry to loved ones, colleagues, or friends. So that's the process that we're going to be working on immediately now, trying to have a major campaign for the general public in order to try to convey a better education and a better outreach approach too. How do we do the outreach to the people who may not always be getting the message appropriately?
Let me just add one note of clarification. In our last update, I did suggest that county health departments, in conjunction with the Marion County Department of Public Health, start communicating meaningfully in a coordinated regional way. I want to make clear, I was not suggesting that elected leaders communicate. That's already going on. The elected leadership is already having conversations. What I thought was missing was a coordinated effort by our county health officials and our county health departments. And I want to commend Dr. Kane in kind of taking that suggestion and coordinating those types of communications. To underscore how elected leaders are communicating regarding a coordinated effort. Just this afternoon, we'll be meeting with Central Indiana chief elected officials by virtual conversation, and then Accelerate Indiana Municipalities, AIM, is having a teleconference this afternoon. So it's good that elected leadership is communicating with each other, and I'm glad to hear that the county health departments, and I want to commend the governor for his encouragement in that regard as well. That county health departments are now coming together in a regional way to address the challenges presented by the pandemic.
Our next question is from Sherry at the Indy Star.
Hi. Yesterday at his briefing, Governor Holcomb talked about making $20 million available across the state for enforcement efforts and other support matters. And I'm wondering if you and or Dr. Kane have thought about how much of that money you might need and how enforcement and other support efforts might work over the coming months, especially with this infusion. Thank you.
Well, let me throw it to Dr. Kane as it relates to the specifics of her department's efforts in terms of compliance and enforcement of complaints against establishments. Let me make one point. Beyond that amount of money that may be available for compliance efforts, as I mentioned in my remark, the city has already dedicated tens of millions of dollars in grants to help struggling businesses, small businesses. And as Thomas previously indicated, most recently we've dedicated $12 million to our help through our help grant program. But let me be clear, beyond that which the governor discussed yesterday, in future assistance programs that I hope will be forthcoming if Congress is able to come up with an additional CARES allocation, we in the city are prepared to disqualify businesses from future programs if they have been found to willfully or repeatedly violate our health orders. This is a matter of life and death for our neighbors, and the vast, vast majority of restaurants and bars and entertainment venues are taking these health orders seriously. But to those bad actors who are ignoring the guidance that Dr. Kane and the Marion County Department of Public Health are giving them, I want to make sure that those bad actors understand that the city has no interest whatsoever in incentivizing your business if you are not complying with the orders and in so doing actively endangering the public health. So beyond that which the governor has suggested can be done immediately, I want to make it clear to any restaurant or bar or entertainment venue in Marion County who we know has been ignoring the public health orders, they run the risk of losing out in the long run for future incentives that the Congress may make available. So I think that's an important point to be made and for businesses to understand. And then I'll again defer to Dr. Kane as it relates to current specifics that her department are making to address complaints against establishments.
So let me just say, I don't try to let any grass grow under my feet. So I actually had a great conversation with our State Health Commissioner, Dr. Christina Box, yesterday evening regarding looking at funding in terms of doing assessments for risk mitigation plans, funding for maybe additional personnel for inspections or regulations related to the number of complaints that we're receiving, because as our cases are going to go up, with our population density, it's going to be a significant increase in manpower that we're going to require. So we look to have an opportunity of having a better understanding how that funding is used and how we can apply for those dollars.
James Briggs from the Indy Star.
Is the reason for closing schools as simple as infections crossing a particular threshold, or have schools reached a point where they can't function properly? And if it's the latter, can you elaborate on why schools have had trouble functioning if there's no known spread occurring within schools?
So I think let me just say I think it's 2 points. So I think one point is, yes, we're seeing a significant percentage based on the positivity rates inside the schools for the different age groups was a major factor in us considering closing schools. But I will also tell you a significant number of schools now are struggling because when you are having to be exposed to someone, and maybe it's a child that got contracted out in the community, but when you're having teachers that expose and staff exposed to those children, they are required to do a 14-day quarantine. And so you're having a significant increase in our school personnel requiring self-quarantining, that there's not additional personnel out there in the community that they can recruit and bring in to provide assistance in terms of even doing the teaching in the classroom. That's not all of them, but I would say a significant percentage of them.
And our last question is from Mary Mills at WTHR.
Hi there. I wanted to ask about enforcement, and that was pretty much answered, but I'm wondering, just in terms of the violations and fines, I don't know if you have this immediately available, but just since you had announced that a couple of months ago, and I expect you will be looking for that to go up.
Definitely go up, and I apologize, Mary, I don't know the exact number of the violations, but our violations are definitely continuing in the hundreds per month, and I know we've easily reached over 1,000 complaints since the epidemic started. So that is a persistent problem, and you'd think that it would be decreasing based on our education, our outreach, and whatever. But unfortunately, we still have a significant number of folks who continue to not meet our standards in terms of what they need for compliance from an infection control standpoint. So I can't hear you. I think, Mayor, are you trying to say something?
Yeah. Taylor, can I? Okay. Yeah, I just want to add one thing to what Dr. Kane has answered to your question, Mary. I mean, the number of people who are not in compliance, while it is indeed sizable, I think it needs to be re-emphasized that overwhelmingly the number of restaurants and bars, entertainment venues, and the like throughout Marion County are honoring and following the public safety and the public health orders that we have issued throughout. So while we focus on those who are unfortunately for whatever reason not in compliance, I think it is important to underscore that most business owners, small business owners, as difficult as these orders are for them, are honoring them, are following them, are protecting their patrons and their employees by following them, and are in compliance. And that is why it's important on a go-forward basis to not to help them in every way possible, as we have been attempting to do with our CARES Act funding to date, but to underscore as well that in any additional incentives that we are provided, we'll be keeping those or the record of the good actors to the highest priority, and the record of the bad actors won't be incentivized. It's just plain and simple.
Thank you all for joining us today. A copy of the presentation as well as the press release will be sent out shortly. Thank you.